Hi David.
Hello.
Thanks for coming along to show us how to set up and check the wall suction units and to connect it to the wall outlet here. That's really important for me because sometimes it's not done properly and that could then compromise patients. So if you'd be able to demonstrate for us how we should do that and check it.
Okay, the first thing I would do is I would actually look at the actual controller itself for physical damage. So you're examining it for any cracks and stuff like that on it. You would look at also the filter, which is down at the base of the suction controller, to see if it's discoloured.
Okay.
And this one looks white to me, so that means it's okay. And if it was discoloured, that would indicate that fluid has somehow got back to the filter. But in this case, it's okay.
All right, so it's good to use.
We're happy with the controller. Then I would fit it to the vacuum, the wall outlet.
So I know the vacuum one is always the yellow.
Yes, that's right.
One. Can this controller fit to any of the other wall outlets?
No, this can only fit to a vacuum wall outlet. It can't fit to an oxygen or an air outlet. So
okay, so it's all very type specific.
That's right. So I'm told the controller upright like so. Put the probe into the outlet, and then I'm just depress it firmly into the wall outlet. You'd hear a small click.
A small click. I could hear that click.
And you would do a wee gentle tug on it. Okay. Which indicates that it's fully secure.
So that tug test is important.
It is very important,
to make sure that they're on properly.
So I would then put the controller up to maximum suction, and then I would occlude the outlet of the tubing. Now, if you look at the gauge here, there's two different scales on it. There's an outside scale and an inside scale. So I'm looking at the outside scale, which indicates millimetres of mercury. So when I turn the controller on, you see the needle going up the scale. And
I saw that.
I'm looking for, if this is working correctly, you should get a vacuum of at least 500 millimetres of mercury.
Right, okay.
Which indicates the controller's good.
Okay.
And then I would turn the controller off, which means, and then I would maybe just adjust the maximum flow, the maximum suction rate.
Yeah, that would probably be normally left maybe halfway so that it can be turned up or down, ready for use.
And that's ready to go.
So just before we move on to removing it, that tug test is really important.
It is, yes.
And also the fact that you've got the end of that tubing occluded when you switch it on to see the needle move right round. Okay, and we're testing it on the maximum suction. Can you just show me then how you would take it to then use maybe a different bed space?
Okay, so to remove the suction controller from the wall, you would depress the collar of the wall outlet in, like so. And then just pull the controller out.
So pressing in that collar is an important part of being able to release it.
That's it. So Lynn, that's the controller checked as if it's working okay. Can you tell me how it connects to the patient?
So first of all, we need a wall canister. So that can then go and be connected onto a wall mounting. But we need something to go in that to collect all the vacuum content. So we use one of these liners and that just pushes in firmly.
Is that the only type of liner that can fit in there?
No, it's not actually. There are blue-topped ones like this, but these are only used in theatres. So the black ones are the ones that are used in clinical use.
So if you use a blue one, it could cause a problem?
Yes. Right. So to connect this unit to the wall unit, we need to put the vacuum into the vacuum port on the top here.
Is that the only port that it can fit into?
It won't fit onto this other bit that sticks up. There is only two.
The other bits, what's that bit called?
This is for the patient side.
Right, so that's the patient port.
But I need to inflate the liner here.
Right, okay.
Okay, so to do that, what I need to do is turn the wall unit to maximum and then cover over the patient port and switch the vacuum on. And you can see that it just houses it properly and brings the liner right down.
Okay. And should that go to a certain level on the gauge?
It goes to above 400.
Above 400.
So now that it's fully inflated, I can switch that off. Okay.
Right. So from here, how does it go to the actual patient?
That's where we need something to connect onto here. We need to use a specific suction tubing to connect onto here that will then allow me to have the stretch towards my patient so that then when it's all switched on, I've actually got suction to suction my patient.
So that's it ready to go?
It is, that's it all checked and ready and good to go.
And would you leave that tubing like that? Or
no, I would leave it covered, maybe in a bag or something, just to stop it getting contaminated so that people know that it's been checked, it's ready to use, but it's not going to get contaminated when it's not in use.
So can you just summarise again what you've said there?
Of course, what we've got then is the wall mounted unit connects in here to the suction unit. We need to then inflate the liner, and it's only the black top liners we use in clinical areas, and then this needs to be connected, the suction tubing needs to be connected but kept clean when it's not in between patient use.
Okay, that's great, thanks.
You're welcome.